and welcome to NAFDAC and Your Health. Every week on the program, we provide you with insightful information about NAFDAC's activities aimed at protecting the health of Nigerians. I am your host, Tosin Adebayo.
This week, NAFDAC continues its statutory role of safeguarding the health of Nigerians by making a proactive move to avert a seeming national infant health emergency. At a press briefing, the Director General of NAFDAC, Professor Mojisola Adeyeye, alerted Nigerians to some substandard contaminated paediatric cough syrups circulating in the Gambia, one of Nigeria's West African neighbours.
On 5th of October 2022, the World Health Organization issued a global alert for 4 cough syrups, warning that they could be linked to acute kidney injuries and children's death in July, August, and September in the Gambia. Interviews conducted on bereaved parents in the Gambia by health authorities and law enforcement agencies revealed how their children are not able to pass urine after being given the syrups. As their conditions worsened, efforts to save their lives were fruitless, which has resulted in the death of over 66 children. This is a worrisome development which once again beams a searchlight on the essence of effective regulation and control of medical products. As a member of the WHO Program on International Drug Monitoring and following our active participation in the WHO member state mechanism on substandard and falsified medical products, NAFDAC is leaving no stone unturned in ensuring that these products do not cause harm to our people. As part of our regulatory controls, NAFDAC has issued an alert to the public on the Public Alert number 039/2022, alert on substandard contaminated paediatric cough syrups circulating in the Gambia. This alert has been widely circulated on our website and all social media handles and sent to all healthcare providers in our database, as well as professional bodies and associations in the medicine supply chain. In addition, we have put appropriate measures in place to prevent entry of these spurious products from the various ports of entry and have activated our internal surveillance mechanisms to mop up these products from the supply chain pipeline if they ever are found in our own country. These suspected medical products are promethazine oral solution, cofzimalaine baby cough syrup, Markov's baby cough syrup, and Magrib N cold syrup. These products were manufactured by an Indian company, Maiden Pharmaceuticals, which had failed to provide guarantees about their safety. The National Agency for Food and Drugs Administration and Control is issuing through this medium to further notify healthcare providers and awaken the consciousness of the public on these 4 substandard products identified in the Gambia and reported to WHO in September 2022. According to WHO reports, laboratory analysis of samples of the 4 products confirmed that they contain unacceptable amounts of diethylene glycol and ethylene glycol as contaminants. Diethylene glycol and ethylene glycol are restricted chemicals which are toxic to humans when consumed and can prove fatal, and indeed has proven fatal again. These chemicals are closely related in chemical structure to propylene glycol, which is the right vehicle for use in the manufacture of pediatric syrups. Poor quality control might have led to non-detection of these dangerous byproducts, and hence the fatality we have on our hands in the Gambia. The notable examples of drug quality problems resulting to serious public consequences and highlighting the significance of NAFDAC include the disaster of poorly compounded chloroquine syrup at UNTH Enugu in 1990, meaning we've experienced things like this before. Another one is paracetamol syrup at UCH Ibadan and Jos Youth Teaching Hospital in 1990. Fake meningitis vaccines in northern Nigeria in 1996. Reported cases of contaminated infusions in circulation in 2002. And the My Pikin saga in 2008, that was a result of negligence in manufacturing, resulting in poorly formulated paracetamol syrup. Under my watch as Director General, we are working assiduously to ensure that this does not happen again in our country. It is pertinent to know that toxic effects of this contamination in cough syrup include abdominal pain, vomiting, diarrhea, inability to pass urine, headache, altered mental state, and acute kidney injury, which may lead to death, and indeed has led to many deaths in the Gambia. The stated manufacturer of this product is Made Pharmaceuticals Limited in Haryana, India. To date, the stated manufacturer has not provided guarantees to WHO on the safety and quality of this product. According to WHO, the 4 cold and cough syrups in question have been potentially linked with acute kidney injuries and 66 deaths among children in Gambia. There are product details that you will find on our website under Alert. The details of these standard cough syrups again are from or include the manufacturer Made Pharmaceuticals, the product name promethazine oral solution, Cofeximalin baby cough syrup, Macof baby cough syrup, Magrip and cold syrup, and the pictures are also on our website on the Alert page. All batches of this product listed above should be considered unsafe and dangerous. The substandard products in this alert are unsafe, as I mentioned, and their use in children and adults will result in serious injury or death. Again, these products are not registered by NAFDAC, therefore should not be in circulation. These products are not registered by NAFDAC, therefore should not be in circulation. To date, these 4 products have been identified in the Gambia, but may have been distributed through informal markets to other countries or regions. That is why we have heightened our vigilance. NAFDAC implores importers, distributors, retailers, and consumers and stakeholders to exercise caution and vigilance within the supply chain to avoid the importation, distribution, sale, and use of the substandard cough syrups. All medical products must be obtained from authorized, licensed pharmacists or suppliers. The product's authenticity and physical condition should be carefully checked. Members of the public in possession of the above listed products are advised to discontinue use or sale and submit stock to the nearest NAFDAC office. If you have these substandard products, please do not use them. If you know somebody that have these products or suffered any adverse reaction or event after use, you are advised to seek immediate medical advice from a qualified healthcare professional.
She calls on Nigerians to be vigilant and report any suspicion of the mentioned drugs being administered in the country.
Healthcare professionals, consumers, and members of the public are encouraged to report any suspicion of adverse drug reaction and substandard falsified medicines to NAFDAC on 0800 162 3322, 0800 162 3322, or email to sf.alert@nafdac.gov.ng, sf.alert@nafdac.gov.ng.
We'll take a short break now. Stay with us.
The MedSafety app is the latest reporting tool introduced by the National Agency for Food, Drug Administration and Control in November 2020 as part of the Innovative Medicines Initiative project. The app is made available to the public in collaboration with World Health Organization, Uppsala Monitoring Center, Medicines and Healthcare Products Regulatory Agency, UK, and National Agency for Food, Drugs and Administration and Control, NAFDAC. The MedSafety app allows users to track safety information of medicines, vaccines and other health products, report adverse drug reaction to a medicine or vaccine, and view data on suspected side effects. When you have received your COVID-19 vaccine, you can use the MedSafety app to report any adverse reaction or side effect you may feel. The app can be used by anybody, irrespective of whether you are a medical practitioner or not. You, your family, and friends, everyone can download and use the MedSafety app to report adverse drug reaction. Just search for MedSafety on Google Play Store for Android and App Store for iOS. When using the app for the first time, the user needs to select his or her region. In this case, Nigeria, and also choose the preferred language of choice. The user will then be taken to the login page where you create an account by providing your email and password, or proceed as a guest. To create an account, you are required to provide the following details: reporter type, example, physician or pharmacist, as well as their name and email address, password with at least 9 characters with 1 uppercase letter and a number. Read the privacy statement and accept. Once you are logged in, the user is presented with a number of tabs, which includes news, products and watch lists. Under the Report tab, the user can report a new suspected adverse drug reaction, ADR. On opening a new report, the user is prompted to input patient details, which include initials, sex, and date of birth. The user is then required to input details of the suspected medicine. These include suspected medicine name, other drug details such as strength, batch, dosage details. Multiple suspect drugs and concomitant drugs can be added at any time. The report can be saved and completed at a later time. A saved report can be found on Pending Reports and can be continued by clicking on the report and continuing from where the user stopped. Enter reaction details, reaction date and outcomes, multiple suspects reaction can also be added. Also, further details about the report can also be included, such as did the reaction cause prolonged hospitalization, disability, congenital anomaly, or birth defect, life-threatening results in deaths, and so on. Finally, you can also add details of any relevant medical history before submitting the report. The user receives a message on the app confirming submission and an acknowledgement in the mail for submission. Reports can be created and saved without internet connection and be sent whenever internet connection is available. The product tabs show all medicines in the NAFDAC list database. It's easier to navigate to a drug or vaccine of interest, and this data is obtained from the WHO Uppsala Monitoring Center. User can also add products of interest to their watch list to get the latest information on the drugs. All products added to the watch list can be viewed in the watch list tab. The News tab displays drug safety information by NAFDAC. This is usually up to date with drug safety information. Registered users can also edit their profile or change app settings. For more information on the app, please contact the National Pharmacovigilance Center (NPC) at NAFDAC headquarters, plot 2032, Olusegun Obasanjo Way, Wuse Zone 7, Abuja, or call 09290511110 or send email to medsafetyapp@nafdac.gov.ng or pharmacovigilance@nafdac.gov.ng.
Welcome back. If you are just joining us, you're watching NAFDAC and Your Health.
The interface with the media was also an opportunity for the Director General to disclaim imposters posing as officials of the agency in a bid to swindle unsuspecting Nigerians.
The impostors or impersonators are asking for money in exchange of employment and other favors. They are asking for money in exchange for employment or other favors. These are impostors or criminals. This is a security breach. NAFDAC and the Director General will never request for gratification to carry out its mandate. I repeat, NAFDAC and the Director General will never result for gratification to carry out its mandate. The Director General will never request for gratification. This is my 5th year on this seat. As a result of this, the social media account of the Director General will no longer be in use until further notice. Members of the public are hereby advised to exercise due caution and report any such activities to EFCC at 234-809-332-2644 or Department of State Services 234-915-339-1309 in Nigeria. For international, please call UK Interpol +44 797 115 3192 or use US Federal Bureau of Investigation +1 800 225 5324. Thank you so much and God bless.
The Director General is optimistic that the C-34 bill that is before the National Assembly, as well as the Pharmaceutical Council of Nigeria bill, passed, will complement the work of NAFDAC, just as interagency collaborations will strengthen the regulatory work in the food and drug sector in a bid to protect the health of Nigerians.
We had the public hearing on the C-34 bill. It is to protect our people from substandard, falsified medicines, and unwholesome food. That is the bill that backs us up on our enforcement. We can arrest, we can shut down businesses. We have about 85 policemen in NAFDAC that work with us every day. That is part of the question in terms of enforcement. What this C-34 bill, the old one has been repealed, the new one has been enacted, because until they sign it up, it is to increase the penalty, is to make sure that there is deterrence. When somebody is caught with tramadol and that person is sentenced to 5 years or 250,000 naira, who doesn't know that that person will use an ATM card? So our C-34 bill is going to be more strengthened so that there is deterrence. When we think of strong regulatory agencies in the world, it's because they have strong deterrent measures. In the US, if your company is worth $200 million and you violate the rule, US FDA will fine you $215 million. That's it. Your company is gone. So there is fear that if I do wrong, I will lose everything as a company person in the US. So the average company or average practitioner is on edge. They are on their toes to make sure that quality, the products they are making have quality because of strong system.
That's all we have time for on the program this week. Make it a date for another insightful edition next week. Same time, same station. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. Importing, producing, distributing, and selling fake drugs and cosmetics, adulterated food, and so on are criminal activities that destroy lives. Join the fight against these heinous crimes by reporting any suspicious activity in your area to NAFDAC. Let's join hands to safeguard the health of this nation. See you next week. Stay safe.